When I was a resident, I was at the climbing gym during a really busy hour when it was packed with people. And all of a sudden, I hear a bunch of screams coming from the other side of the gym, and I see a big crowd of people clearing out from that area. So I kind of like push myself through that crowd to see what's going on, and I see a guy lying on the cushion mat at the base of the wall, holding his shin, moaning. So after I ask people to give me some space, I ask him to move his hands so I can see what's going on. So his hands are completely covered in blood, and he moves his hands, and I see that his shin is bent at about 60-degree angle, and his tibia is sticking out about 2 inches from the skin. So I recruit four burly looking dudes to help lift him up and carry him out to the front entrance while I'm kind of stabilizing his shin. And there's a long wooden bench near the front entrance where the front desk was, and we lay him down there. I spoke with the front desk staff, asking them to call 911. And during that time, I also kind of noticed that there was a group of people that were just registering and signing their waivers to climb for the first time. Anyways, I redirect my attention to this guy. I check his foot. He's got good pulses. The cap refill was good, and he had good sensation of light touch. And so I say to him, hey, your shin is broken in a really serious way, and your bone is sticking out of your skin. So the pain is often caused by the bone kind of flopping around. So I can either splint it and send you to the hospital where they'll straighten it out, or I can just try to straighten it out right now. And he says, just do it. And I say, man, like, I don't have any medications. Are you sure you want me to do this? And he says to me, just get it done. And so I asked one of the guys to stabilize his knee at 90-degree angle while I pull traction on his ankle. And immediately I can see his tibia suck back through the wound, like, and straighten out his leg. And after that, I splinted it with a cardboard box circumferentially and sealed it with a climbing tape. So I go back to the washroom because my hands at this point are completely covered in blood. And when I come back from the washroom, I notice that the entire gym has completely cleared out. Anyways, paramedics came, picked him up, took him to the hospital. And about a year later, I actually bumped into him in the climbing gym again. And he told me that he had surgery and has returned to all of his activities with no detriment to his walking or ability to do any activities. So that was one of my proudest moments in the field.